Spinal cord compression. Introduction. The spinal cord is the bundle of nerves that carries messages back and forth from the brain to the muscles and other soft tissues. As the spinal cord travels down the back, it is protected by a stack of backbones called vertebrae. They also hold the body upright. The nerves of the spinal cord run through the openings between the vertebrae and out to the muscles. Spinal cord compression can occur anywhere from the neck, cervical spine, down to the lower back, lumbar spine. Depending on the cause of the compression, symptoms may develop suddenly or gradually. They may require anything from supportive care to emergency surgery. Definition. Spinal cord compression develops when the spinal cord is compressed by bone fragments from a vertebral fracture, a tumor, abscess, ruptured intervertebral disc or other lesion. It is regarded as a medical emergency independent of its cause, and requires swift diagnosis and treatment to prevent long-term disability due to irreversible spinal cord injury. Spinal cord compression occurs when a mass places pressure on the cord. A mass can include a tumor or bone fragment. Compression can develop anywhere along the spinal cord from the neck to the lower spine. Causes. One of the most common causes of spinal cord compression is the gradual wear and tear on the bones of the spine. This is known as osteoarthritis. People who develop spinal cord compression from this are usually older than 50. Other conditions that may cause spinal cord compression can develop more quickly, even very suddenly. These can occur at any age. Abnormal spine alignment, scoliosis. Injury to the spine. Spinal tumor. Certain bone diseases. Rheumatoid arthritis. Infection. Sign and symptoms. Symptoms of spinal cord compression can develop quickly or slowly. It depends on the cause. Injuries may cause immediate symptoms. Tumors or infections may cause symptoms that develop over days or weeks. Wear and tear of the spine may take years to cause symptoms. These are common symptoms. Pain and stiffness in the neck, back, or lower back. Burning pain that spreads to the arms, buttocks, or down into the legs, sciatica. Numbness, cramping, or weakness in the arms, hands, or legs. Loss of sensation in the feet. Trouble with hand or leg coordination. Foot drop, weakness in a foot that causes a limp. Loss of sexual ability. Pressure on nerves in the lumbar region, lower back, can also cause more serious symptoms known as cauda equina syndrome. If patient have any of these symptoms, patient need to get medical care right away, typically in the emergency room. Loss of bowel or bladder control. Severe or increasing numbness between the legs, inner thighs, and back of the legs. Severe pain and weakness that spreads into one or both legs, making it hard to walk or get out of a chair. Diagnostic evaluation. To diagnose spinal cord compression, the healthcare provider will ask patient questions about the symptoms and do a complete physical exam. During the exam, he or she will look for signs of spinal compression, such as loss of sensation, weakness, and abnormal reflexes. Tests that help with the diagnosis may include X-rays of the spine. These may show bone growths called spurs that push against spinal nerves. X-rays may also show an abnormal alignment of the spine. Special imaging tests of the spine. A CT scan or MRI will give a more detailed look at the spinal cord and the structures surrounding it. Other studies. These may include a bone scan, a special X-ray or CT scan taken after injecting dye into the spinal column, myelogram, and electromyography, EMG, an electrical test of muscle activity. Management. The medical team involved in treating the spinal cord compression may include arthritis specialists, bone surgeons, nerve specialists, and physical therapists. Treatment depends on the cause and the symptoms. It may involve medicines, physical therapy, injections, and surgery. Except in cases of emergency, such as cauda equina syndrome or a broken back, surgery is usually the last resort. Medicines may include non-steroidal anti-inflammatory drugs, NSAIDs, that relieve pain and swelling, and steroid injections that reduce swelling. In more acute spinal cord compression, high-dose steroids are used to save nerve cells until other treatment can be given. Radiation therapy may be used to shrink tumors that are compressing the spinal cord. Physical therapy may include exercises to strengthen the back, abdominal, and leg muscles. Patient may learn how to do activities more safely. Braces to support the back or a cervical collar may also be helpful. Surgical treatments include removing bone spurs and widening the space between vertebrae. Other procedures may be done to ease pressure on the spine or fix fractured vertebrae. The back may also be stabilized by fusing some of the vertebrae together. Some other treatments that may be helpful for some people are acupuncture and chiropractic care. Prevention. Many causes of spinal cord compression can't be prevented. Patient can help prevent symptoms of spinal cord compression caused by gradual wear and tear by keeping the back as strong and healthy as possible. Get regular exercise. Exercise strengthens the muscles that support the back and helps keep the spine flexible. Maintain good posture and learn how to safely lift heavy objects. Other good body mechanics include sleeping on a firm mattress and sitting in a chair that supports the natural curves of the back. Maintain a healthy weight. Excess weight puts more stress on the back. It can contribute to developing symptoms of spinal compression.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.